Hey, I love all parts of conversations with healing and health and how to empower people to maintain their health in, I will say, less toxic or less risky ways. I'm not a huge fan of many things in traditional medicine, some of which I'm a massive fan of. If I'm in a car wreck, take me to one of the big hospitals, to the ER, and do what you can to save my life. But there's other parts that I don't feel is either advanced enough or is honest enough. But I can tell you a doc in town who I admire, Dr. Redd. Welcome to Vital Health Radio.
Thank you so much.
It's such a cool concept you have, and I'm not going to speak for you, but I think you said it's one of the only concepts in this country of what you do. And I'll tell you, before he tells you what he does, I have been to him probably 4 times. I have sent multiple people over the years. Clint has been there with his daughter. Did you go yourself or just take your daughter?
No, I've been 2 or 3 times. I sent my daughter once, and I've sent my mom, I think, twice. So yeah,
we're in an age since COVID, especially of convenience and walk-ins and drive-ups and get it fast. Well, he kind of beat the curve because you do surgery in a super efficient, safe, reasonably priced manner. Tell people what Quiksurg really is, and you're located downtown, but we'll talk about that later. But what do you do?
Yeah, Quiksurg, the best way to think of Quiksurg is it is a urgent care center for surgery, for minor surgery, really is what it is. We don't do any primary care there. We just do minor surgical procedures. That means anything under local anesthesia we can do just about.
Tell people what that means, local anesthesia.
Local anesthesia means we put the anesthesia right in where we're going to work.
That means you're not being put under with gas.
That's correct.
Okay.
So you don't have to show up not having eaten anything you can eat and the whole thing. So if you get cut on your arm, we just put the anesthesia right there in the cut, and pretty soon you can't feel anything.
No matter how much you ask, he will not put you under. So don't go in asking for that either.
Hey,
Clint, I need you to step out, please, sir. You can't keep asking to put you under. That's not going to work. Yeah.
And you have such skilled hands. I'm just speaking from experience. What did you do before this? What was your medical practice?
Yeah, I was a general surgeon here in town, mostly at Park Ridge Hospital, for 35 years before I started.
Wow,
this.
35.
I started this clinic in 2015, and at the time I was still a general surgeon as well, so I kind of did both things at the same time. Then eventually, about 2017, I went strictly to this. Just stop the surgery.
What brought this idea to your head?
It mainly came from I didn't really want to retire, but the hours and the stress of being a solo practitioner were just getting too much after 30-something years. So
did you work for corporate medicine, or did you had your own practice?
I had my own practice.
Really?
I think I was the last dinosaur to do that.
Oh, I bet.
Yeah. So it was rough, but I began to think, what could I do? I had worked in the ER at different places as a resident and that sort of thing, but I had really forgotten a lot of the things about hearts and things like high blood pressure and things like that you'd see in the ER. So I started thinking, well, is there any other thing I could do? And the idea of just doing minor surgical things just sprouted out. And I tried to look around to see if anybody else had done that. And I couldn't find anybody in the country, and I still have a hard time finding people who do it. And yet a day doesn't hardly go by that we don't hear someone say, man, this is a great idea, or I really like this concept, or, something.
But it'd be hard to say franchise this kind of business, because I would guess that a surgeon in the middle of his career, it wouldn't offer enough for them at that point. But later on in years, it could be awesome. Yeah. Or people who are retired who just felt like, hey, I got this skill that I spent decades learning. I hate to just dispose of it and just, cook steaks on a grill and cut a steak up. That'd be the only time I ever do surgery.
Yeah, and I wasn't really ready to hang it up yet. I mean, I wasn't thinking screwy or anything like that. So I said, okay, it's time for me to just see if I can get creative and do something like that. And we put it together, and it's very slow beginnings because we had COVID there to deal with, and nobody was going to any doctor, surgeon or no surgeon, even though we had masks on. So it was kind of slow, and then things have just slowly built up. It's been 10 years now. We've been there 10 years.
Well, anybody who can survive, I think that Clint probably knows the numbers better than I do. You know, the amount of people who go out of business the first 5 is significant, but it's the next 5 that then wipes out another chunk. And to make it a decade, you are in the vast minority, especially being innovative and an entrepreneur as you are. And I don't mean to be negative, but most physicians are not good business people.
No, they're not.
And you are, obviously. So
let me ask you a quick question.
Yes.
On this. I'm interested on, you'd owned your own practice, but this was a different kind of business, right? It's a different model.
Right.
Did it surprise you? Were there things as you started it like that's harder than I thought? This is easier than I thought. That's a lesson I thought I'd learned. What the heck happened there? Those kind of things.
Yeah, there were quite a few things to learn. You know, in the hospital, you go in and there's 5 patients scheduled for your operation and for their operations, and you just go through the schedule. Then you see folks preoperatively and postoperatively, and this is a much more. We see a lot of repeat patients with this. You know, when I took somebody's gallbladder out, I really didn't want to see them again. I didn't think their gallstones would grow another gallbladder. So I just said, you know, that's the way that's going to be. But this was, if someone comes in with a skin lesion, they want it off, you know, in 2 or 3 years, they might have another skin lesion they want off.
Well, it's the fact of growing old. We have these barnacles,
That's right.
I guess. And I know you enough to know I think you enjoy the personal contacts and the relationship that you do build.
I do. I think I like that more than anything else, to be honest with
I
you.
do too in the nutrition world.
It seems like you went from a transactional relationship to actually getting to know some of your patients. It's almost the old school way to practice medicine of, oh, how's the kids?
Yeah.
It's been a while since I've seen you, that kind of thing.
It is. It really combines kind of the doctor feel that I wanted at the beginning, and in the surgical world, you can get busy so quickly that it's hard to have that.
Yeah.
But this, I have that, and we schedule patients specifically, so I have the time to do that.
Yes, you do.
So.
Yeah, when you see old patients like Clint, you say to yourself, man, he's gained a lot of fat.
Yeah.
But you don't really say it because you're such a cool guy. Right. So you wouldn't say that.
As long as that little thing on my stomach doesn't get any bigger, I don't care what he thinks. Somebody's like, you know,
your stomach's getting bigger.
No,
yeah.
but the little thing on
the
my
little
stomach,
thing.
in proportion, it's fine.
Okay.
That's the. I will say it. I told them the story before we started, and it's a testament to you. And I'm not saying you do this with everybody, so I don't want everybody to try this. But I took my daughter in because she had a little something that was worrisome, and I think it was in a moment where it was around a holiday or something. It was hard to find anybody open, and I called. You know, the nice lady said, "Come on by," and I walked in, and it was basically one of those things. And I told her, I said, "She's scared. I'll pay whatever I owe."
Yeah.
And you literally shut the door and open the door, so she's fine, and she's okay. Y'all can get out. And I'm like, and we left, and I was like, okay, y'all were kind enough to us. You were like, we didn't do anything. Get out of here. You just took the worry out of her mind. You don't get a lot of that. And there's most of the time I've come in, I've sat with you, and you've had to go over some stuff with me. But that was immediate for me to take the worry. You just needed to look. And really, if I'm not mistaken, you had looked at it in the hallway, and you're like, I think she's fine, but I think you saw she was worried. Yeah. And you're like, well, let me act like I've got to spend some minute with you. You just calmed her fears. It was really good. Yeah.
Well, Clint's the kind of guy that if he accidentally didn't realize he spilled a drop of ketchup on himself, within minutes he'll be calling you and want the ketchup removed because he thinks he's dying the next day.
I've Googled it. I've chat GPT'd it. I know it. I should lay down.
If he could just wipe it off with a paper towel.
Absolutely. Yeah.
Dr. Google gets called.
Hey, listen, my problem is I don't go to the doctors. That's my problem. Yeah. Well, I come to you when I have to. That's my issue.
Well, tell people what things do you work on, I guess we could talk about.
Yeah, so we do, we call it a lumps and bumps clinic. So we do things on top of the skin like moles people don't want, or skin tags, or possible skin cancers we do. We do things under the skin, so that would be things like a lipoma, which is a fatty tumor, or a cyst, which goes under the skin. They can get infected, and we see those are probably the most common things we do.
Now, lipomas, how deep do they go?
Not very deep. They're usually just right under the skin, and so they don't go very deep at all. And I mean, we've taken some big ones out.
Really?
And they can get pretty big. So
really, I have one. I've had it 40 years. It's kind of a little bit on my chest. Hasn't changed in 40 years.
Yeah, that's good.
So it's certainly fine with me. It's my friend. I talk to it sometimes when I'm lonely at night. My little Apoma.
Yeah. We've had folks name them and everything.
Oh, really?
This is how you lose guests on a radio show right here. Starts naming his lumps. We're out. Yeah.
Have you got any interesting stories of, like, I'm sure you got some odd things that may have happened over your years?
Yeah. In 10 years, we've seen 3 gunshot wounds.
Have you?
Yeah. So I didn't really, they weren't fresh gunshot wounds. The most interesting one was a guy who came in and he had a slug in his shoulder. And I said, well, when did you have this? When did this happen? And he said, it was about 10 years ago. And I said, well, 10 years ago, didn't they take bullets out of people or what? And he said,
Civil
well,
War?
they would have, but they were worried about the 3 in my colon. That
Oh my gosh.
yeah. So he said I was on the operating room table for about 12 hours, and I think they forgot all about the one in my shoulder. It eventually, and you really couldn't feel it initially, but they'll work their way to the surface eventually.
Will they?
Mm-hmm.
And that was what was happening?
And that was what was happening.
You could actually feel it?
You could feel it, and it was 44 caliber, large.
And you removed it?
We did, yeah.
And what did that bullet look like when it came out? Had it changed any?
Not a lot, to be honest with you. It really hadn't. It really wasn't look deformed or anything.
Well, tell me that guy's name, because I don't want to mess with him. I can tell you that. He must be something.
Yeah, he was a great guy.
Did you ask him how? I don't want to hear how. Did you ask him? You just don't get that every day. Like, how'd you get shot?
Well, I did, but he didn't really want to come through with the whole story. He just said he was walking down the street, minding my own business. Yeah. That was kind of that's kind of the standard.
That's when, as a surgeon, you go, awesome, great. We'll just take this out of you and get you on your merry way, sir.
That's right. No, he turned out to be a nice guy, but
interesting.
And we got a metal pan, like Doc Adams on Gunsmoke, and we tossed it in the pan, and it was great. So
what a good story. Yeah. Have you ever had any that were like almost impossible that you got into and you kind of wish you hadn't have?
Only a couple, and one was It was I thought it was a lipoma, but it was a pretty rare tumor that happens under the skin. That I knew once we got in there, it probably wasn't what I needed to be in there for. So we just kind of closed him back up, and I made an appointment for him for a general surgeon in the hospital. So.
Yeah, because you can't. I mean, you're not in a position to do deep surgery, and some people need a general anesthesia.
That's right.
I tell you one thing: this guy's got not only skills as a surgeon, but a skill as an injection person. The injections you give me, I mean, they sting, but they're so much better and easier than some people who give shots. And that lidocaine is magic. It just is magic, isn't it?
Magic.
Can I ask a quick question? It's about how you were received in the medical community.
Yes, good question.
This is something that's I find intriguing. Whenever someone because we have people on ed staff that have left the medical community. You're still in it,
right?
But you're doing something different. It's a different model. How was that received with your peers and folks when you told them what you were doing? Was there a lot of naysaying or good luck, or is it one of those they didn't care, or what? How was the reception?
I think in general it was good. One thing I noticed was initially we tried to do a cash-only business, but we found out that a lot of people who normally would refer to us with their insured patients quit referring to us because they thought all we did was cash. But so we still took insurance, and if people come in and say, I want to use my insurance, of course we do that.
Oh, you do that. So you do full, just like a regular dog.
We do.
I didn't really realize that, but I'm a cash pay kind of guy.
Yeah, I am too. And so I prefer that everybody do that because it's just so much easier on them, on me, on everybody.
Does insurance really reduce the amount of earnings that you have?
Insurance is a funny deal because it really is a situation where they decide what you do in a lot of cases. I'll try to order, say, an ultrasound of something, and they'll say, no, you have to do this first before you order the ultrasound. And I said, well, wait a minute. I'm here with the patient. I'm, touching the patient and talking to the patient, and maybe I should decide that. So insurance is a funny deal.
Well, how about telling people where you are exactly? Very easy to find. I'm always impressed with how easy I find parking spaces also. Yeah. But tell people where you are and kind of your hours and things.
Right. We're in the Public Shopping Center in North Shore. which means you can park in the Publix parking lot, which is really good. In the North
Yes.
Shore, there's not much parking. So,
I look up and always get right across the street, but I do usually
Okay.
come in the early mornings.
yeah, that's a better situation if you can do that. But if you can't, Publix parking lot is still good.
And it's literally 1 minute to your place.
Right.
Yes.
It's just if you walk toward Publix and kind of veer toward the right and walk around, you'll see Great Clips, and then we're right next to Great Clips.
And you're there Monday through Friday?
Monday through Friday. I still work a half a day at Park Ridge Hospital in the Wound Care Center there.
Oh, do you?
So I'm half a day in wound care at Park Ridge and half a day in my clinic on Fridays, but every other day I'm there.
So at Park Ridge, you're not doing surgery, you're just helping
That's
people
right.
with leg ulcers and other
That's
wound
right.
issues. How cool. You're such an experienced man. I mean, you're old school, and I think we're all going to miss us old timers when we're all fading out.
I am definitely old school. There's no doubt about that.
Yeah. And I mean, there'll be a new change of scenery, but hopefully they'll figure out how to make it work. But, the thing about it is, not getting into all that depth, is that the work ethic doesn't seem to be quite as committed in that
That's right.
in people who are less than 50 almost. I don't know.
No, that's really true.
Yeah. Well, you've worked hard. You've earned it, and I respect you greatly. And I want to Nutrition wants to do all we can to always partner with people who are truly ethical and helping other people on their journey to health, as we try to do at the store.
And you've sent a lot of patients, and I appreciate that.
Thank you. And when you have a question or someone needs our services, you always send them to us, and you shop there too.
Yes,
so
I
thank
do.
you very much. I probably met you. I don't know. It was pre-COVID, I think.
I think
or
it was.
during COVID.
Right.
Somehow that
Yeah.
we connected. All right. And we always have your pamphlet at Nutrition World. If you forget this guy's name, you don't even know how to look at Bottle Health Radio, but you say surgeon, we will have your flyer at Nutrition World as long as you're in business.
Great.
Which will be
Thanks.
hopefully as long as I am, which is a long time.
Okay, good.
Thank you, Dr. Redd.
Thank you.